It's so important to break down stigmas and bring awareness to issues like gun violence prevention and overdose awareness. Today, we chat with the Franklin County Coroner, Dr. Nate Overmire, about how data is vital to informing decisions that help our communities, and how he balances his role as coroner with being a family doctor. Plus, trick or treat, can kids really get a sugar high from eating too much candy, or is that just a myth? Test your Halloween candy knowledge right along with us. Some of these questions are pretty tough. All that and more coming up on Health is Real. Come in, stay a while. Andrew Stinson alongside Angela Taw. The name of the podcast is Health is Real from Franklin County Public Health. Angela, how's it going today?
Pretty good. Happy to be here.
I'm happy to be here too. We are actually on location today at the Franklin County Coroner's Office here at the Franklin County Forensic Science Center to speak with our guest today, Dr. Nate Overmire. He is the Franklin County Coroner. Dr. Nate, how's it going today?
I'm doing good. I'm so happy to be here with you all.
Great. Well, it's lovely to be here and speak with you. So just a little bit, I think, for the folks at home, what does the coroner's office do? I mean, it sounds like a big job. What does the coroner's office do?
So our official role in the county is to determine the cause and manner of death for those decedents or people who die within the county that come through our jurisdiction. In 2022, there was about 11,000 people in Franklin County that died. Of those 11,000, we took 3,000 of those cases because they fall within our jurisdiction. Someone who dies by injury, like a violent death, or a non-so-violent injury like a fall. Someone who dies suddenly, unexpectedly, or an unusual death, if there's some sort of a suspicion around the death, it becomes our jurisdiction, and it's our role and our job to determine that cause and the manner of death. There's 5 manners of death. There's natural, which we try not to deal with too much. That's the role of the primary care doctor or an attending physician who's been taking care of someone for hopefully a long time. But then the other 4 are strictly within our jurisdiction. So homicides, suicides, accidents, and those include motor vehicle accidents or overdoses, and then undetermined. And that doesn't mean that we don't know. It's usually a combination, like there's evidence of a suicide, but also evidence of an accident. And if we can't really put that together, then we call that undetermined.
Okay.
So that's our role.
Interesting.
That's our official capacity.
Yeah.
In my role as coroner, I'm a family doctor by training. So as a family doctor, I love talking about preventative medicine and how do we prevent these diseases to take someone's life earlier than expected. And so I go out in the community, talk about things like diabetes or heart disease and how do we properly manage those things and so people can live long and healthy lives, but also those non-natural diseases that come to our office. So how do we get folks into addiction treatment or mental health services to help with their mental health? How do we get folks with the resources they need so that they don't get shot or they're able to take care of themselves and not take their life by suicide?
Yeah. Wow.
That's some heavy stuff. Sorry.
For sure. No, that's okay. I mean, hey, that's what you deal with. But so you had mentioned that you're a family doctor. So how did you become the coroner? Like I'm sure that was probably an interesting leap of career. So how did that happen?
So it kind of came out of the blue. And Angela, it was literally a calling. I got a call literally out of the blue from someone asking if I would be interested in being coroner. As you may know, the coroner is an elected position, and my predecessor retired halfway through her term, and so someone needed to be appointed to that role. In Ohio, we have a coroner system. Most other states have a medical examiner system, and actually within Ohio, there are 2 counties that have a medical examiner system within their county, Cuyahoga and Summit, and so those coroners, or in that case, a medical examiner, is always appointed, and it's not an elected position. But in the rest of the 86 counties in Ohio, the coroner is elected. And when I got the call, they said, Nate, would you be interested in coroner? And I was like, well, it's not exactly what I thought of when I was in this sort of space of wanting to run for maybe some elected office or a public role, helping to serve the public in a different capacity. But the more I thought about it, the more I thought, well, our office does deal with things like gun violence. And so I can talk about gun violence reduction or suicides and suicide prevention, overdoses and overdose awareness and prevention. And those are big topics, and it deals with so much of what I do in family medicine. I help people with their mental health, with their addiction. I treat them in both cognitive behavioral therapy, but also medication-assisted therapy on a whole host of topics.
Yeah.
And so this is an area that I felt that I could convene a group of stakeholders and policymakers to help improve these outcomes and make a big impact in my community this way.
That's awesome.
Yeah.
That.
Yeah, I mean, you already kind of answered what I wanted to ask you about how your job overlaps with public health here, Franklin County Public Health. I know for International Overdose Awareness Day recently, we've had some overlap. Can you talk a little bit about that?
Yeah, we had a great International Overdose Awareness Day event. We were able to be so fortunate to have overdose awareness dollars that was able to fund a guest speaker, David Sheff. He is the father of, there was a movie about him and his son's life called Beautiful Boy. And so we were able to get the real life dad, who was played by Steve Carell, to Ohio, to Columbus, to share his journey, share the story of his life and his son's life and how he dealt through and worked through all of that. And so we have an overlap with public health in that we have the data of those 3,000 people that die within our jurisdiction. We know why they die, and we have some other important demographic information that we can start to formulate patterns and trends that we can give to stakeholders and policymakers, whether it's at the State House or our local Franklin County Public Health or Columbus Public Health, and say, hey, here's a trend that we're seeing, both maybe in real time, but also when we look back retrospectively and analyze some of the data and say, gosh, this population, this segment of our population that's vulnerable or is a new emerging trend, policymakers, stakeholders, here's the data that we see, now do something with it. Because we're not providing direct services. Those who are providing direct services, here's some of the information that we're seeing, and we want to help and partner with you to improving that health and well-being of our population here in Franklin County.
Yeah, I mean, obviously from at the health department's perspective, we know how important data is. So it's unfortunate data that you're bringing in, but really needed and helpful data so that we can see those trends, make those adjustments in how we're providing services. So that's really sweet. I didn't realize that your office provided all of that.
Yeah, thank you.
What is something that maybe you're most proud of in your role?
Well, I'm very proud of the staff that we have here at the Franklin County Forensic Science Center and the Office of the Coroner. We have over 65 people, folks who have a high school diploma, all the way ranging to terminal degrees. Folks who have gone through 14 years of post-high school education. And so I'm really proud of those 8 forensic pathologists that we have here. They are amazing physicians, clinicians who really are the family doctor of the dead. They take a holistic approach here. Not only our official role is to determine the cause and manner of death, but they and others here at the office are so empathetic and are so passionate about providing compassionate care. And families are grieving. This is oftentimes a family's worst day when they find out one of their loved ones has died by suicide, homicide, or an accident. This is a sudden event, and they're grieving and they're hurting. And I love that we have a dedicated staff here, all the way from case secretaries to our morgue staff, to our investigators, to toxicologists, who are providing that holistic wraparound care for families who are grieving and dealing with a really hard day. So I'm proud of the empathy and the compassion that comes out of this office that I see day in and day out. And I want the staff here to know how proud I am of the work that they do, because it's not easy seeing, unfortunately, a baby once a week. Someone under the age of 1. We have teenagers, we have older adults that are otherwise healthy, and seeing these folks come through our office, and we have to deal with them individually because they are important. They're our patient, and we have to take care of them, but we have to help take care of the family who's dealing with one of the worst days of their life.
Yeah, you have a lot of patients that you're interfacing with because you have the individual that you're, helping to bring their story to light through their death, but then also the family. But I'm sure that helps to have that physician background, to then think oh, these are sort of all of our patients in a way, and we're here to take care of all of them. That's really sweet.
And I'm really proud of, it's all about justice for me.
Yeah.
How do we bring justice to this life, either who's a victim or was struggling? And then again, like you said, how do we highlight their story? How do we share their story so that we're breaking down stigma, that we're bringing justice to this decedent or the family, to the victims who are going through so much.
Yeah. You've talked about a lot of people who you interface with, right? It's their worst day. But there's a lot of people who you may never interface with at the coroner's office. So what's one thing you wish people knew more about what you guys do here at the coroner's office, or just the coroner's office in general?
Fortunately or unfortunately, you will only need the coroner's office when you need them, right?
Right.
So if your loved one has passed away from a non-natural disease state in Franklin County, you're going to utilize our services. And I want people to know that we are here to help. We are a friendly group of people, even though we deal with death day in and day out, but that we are here to help. And we want the process of when someone has passed away through the time that we release that decedent to the funeral home or to funeral services, that we are approachable, we are providing accurate results, but also timely results. Certainly they have to be accurate. For example, in our toxicology department, we run a test 2 different ways, and they have to end up with the same result. That's our validating tool, and we have to have 100% accuracy rate. We can't allow a sample to be positive with something and then not positive with something on the 2 different tests. They have to be 100% accurate. And so I want the public and the residents of Franklin County to know that we are dedicated to accuracy, that everything we do here is based around evidence-based practices, that we strive for excellence in terms of determining cause, manner of death, and that we're here to help protect the community, and we are always thinking about public safety and how do we, again, talk to public health? How do we talk to law enforcement and help bring folks to justice? I really value the coalition of partners that we have as well, ranging from law enforcement to, again, public health to there are so many other stakeholders and representatives in our community that we touch base with because death touches all of us and it will touch all of us someday. And so how can we do the best job of providing that care right at or around death is really important to me.
And, something we like to ask all of our guests, it's kind of like a Miss America question you might hear on a pageant, but I think it's pretty important, though.
Yeah.
Like, if you could wave a magic wand and make any, like, public health-related change, like, in your world, what do you think you would do?
That's an interesting question. This could get controversial.
That's okay. We've had very controversial answers.
Bring on the controversy.
Yeah.
Let's go.
Oh, man, but in public health, it's all about a balance of, I respect people's individual freedoms, but I also respect the community safety that we have to, that's the balancing act. And so for me, in my role as family physician, I do struggle. It's always interesting to have those crucial conversations about vaccines and how important the safety is around vaccines. I testified on a few bills regarding vaccine safety, and there's a lot of misinformation and misconceptions about vaccines that I wish I could kind of, if I had a magic wand, I would, that's the one that I think has the most bang for the buck, because if we're not vaccinating our children for example, measles, mumps, or rubella, measles is a deadly disease that we have gotten rid of when the vaccines were first introduced. But now we're seeing a resurgence of diseases like that that are having an impact on our kids and our families. And that's a preventable illness, a preventable disease, or even a preventable death that should have been prevented if more people got vaccines. I see it as controversial because I know there's a lot of misconceptions out there about vaccines and vaccine safety, so I could get some pushback. But that's the biggest bang for my buck.
Yeah.
But also, when we're talking about things at this office, overdoses. So I lost my cousin to an overdose, and I miss him every day, right? And do I wish that there were better, whether it's providing services to people who are going through that, the disease of addiction, and do I wish that we had an easier system for folks who are dealing with that to get the help they needed? If I can wave my magic wand and kind of integrate some of those services a little better, I wish we had something like that.
Yeah, fair. You get 2 wands because you wear 2 hats. So
Thank you.
there you go.
2 wishes you can make.
2 wishes.
Would I love to have no babies under the age of 1 come through this office again? Yes. If I could wave a magic wand, I would want every baby to be able to grow up and live a long and healthy life. And it's unfortunate that we have a disproportionate amount of Black babies in Franklin County that die under the age of 1 compared to their white counterparts. And so for me, it's just this racial disparity, which ties into socioeconomics and a whole host of other things within that. But gosh, would I love to see no more babies, especially the Black babies that come through our office? That's a magic wand I would love to wave.
Now, if I know SIDS, if a child died of SIDS, would they come to you to try and determine, or is that considered more of a natural cause?
That's a good question. And so the new term is SUID.
Oh, okay.
No, it's okay. No, it's great. No, it's all good. So the new term is sudden unexplained infant deaths. For those SUID cases, so those sudden unexplained infant deaths, those would come through our office.
Okay.
A baby that has a known chromosomal abnormality that was discovered in utero, that might be a case that if it was born and then was able to live for a little bit, that might not come through our office.
Gotcha.
Because that's a known natural disease process. Yeah. But for those that are unexplained or sudden, then those would come through our office. And we have, unfortunately, about one a week on average, and that breaks my heart, right? That's a baby that's not here with us anymore. It's a family that's going through one of the worst days of their life because this mom has just delivered this likely healthy baby, and now having to deal with the loss of that child I can't imagine.
Yeah.
Celebrate One is an amazing city agency here in Franklin County that's working to prevent and reduce infant deaths in our community. And so tackling some of the root causes, whether it's affordable housing, tobacco use in the home, safe sleep, those are all things on the table that we're working with them to impact this really important topic of infant and maternal mortality. It's been an honor working with Director Tong at Celebrate One and the rest of their staff as they are working day in and day out to help families understand here's the risk factors that are in your home and hopefully make an impact and a difference to prevent these baby deaths, which is really important to me.
I can't imagine being in your position and seeing like all the people come through, the families come through. How do you guys, like as an office, like, I don't know, take care of each other, support one another? What do you guys do? Because that could get really heavy really fast and be easy to take home and kind of carry that emotional weight with you.
That's such a good question. And we talk about that a lot here because we do have these sort of deaths that really break people's hearts and get people upset. And so I encourage every person, whether you're a toxicologist, a case secretary, someone in the morgue, someone in investigations, and you're having a rough time with a case, it's important to be aware of that. And I think we have a culture here that looks out for each other, number one. So if we're seeing someone who's maybe has their head down or has had to take a few breaks because they're upset, all right, let's identify that first, and then let's get you to the right sort of resources. And I encourage people to take some time off to get in a better headspace. I encourage people to reach out to the EAP or the employee assistance folks who help with counseling or some talk therapy. I encourage folks to have a private counselor. That's one of the best things that I am fortunate to have is, I have a counselor who has professional understanding and can help me. That's one of my ways that I cope and ways that I manage stress is that I have a counselor that helps walk me through things that I'm dealing with here at the office. And I encourage everyone to have, I don't think it's a sign of weakness. It's actually probably a sign of strength because you've identified that you have a high stress job or you're in a high stress environment. And to have someone who has professional understanding of the issues that you're going through can only help. And that really helps me. And I encourage the staff to have someone like that. Or it could be a family member, whatever they need to help them cope through is I'm always in favor of that.
Yeah. Well, thanks for sharing that. I think that's an important call out for mental health and sharing that you have your own counselor. All of us sharing our stories goes to break down the stigma. So
it's
that's
important.
Great.
Yeah, it's important to break down the stigma. Dr. Nate Overmire, he is the Franklin County Coroner. Thank you so much for coming on our podcast today.
Thank you so much for having me. It's been an honor.
All right, well, it's Halloween season. It's spooky season. I've got a quiz here. Test your candy IQ. This is from the New York Times. See how much you really know about sweets with this quiz.
Okay. I think I know a lot about sweets.
You think so? We got 10 questions here. Let's see.
Pretty good.
Question number 1. True or false? It is possible for a child to get a, quote, sugar high after eating too much candy. True or false?
Well, I mean, probably true, right?
That's actually not correct. It's
what?
False.
No, that's...
Parents know all too well that certain sugar-infused activities like gorging on candy on Halloween night can bring out a kid's wild side. But the, quote, sugar high myth has been debunked. There's no evidence that sugar can influence a child's behavior or cognitive function or make a child hyperactive. New York Times.
What?
Yeah.
That okay.
Good to know.
Wild.
Yeah, I mean, you hear all the time, like, oh, he's got a sugar
All
high.
the
He had
time.
too many
Yeah.
Snickers bars, whatever. All right, question number 2. Scientists have found links between eating dark chocolate and what? Lowered blood pressure, an inability to sleep, a reduced risk of stroke, or all of the above. Scientists have found links between eating dark chocolate and lowered blood pressure, an inability to sleep, a reduced risk of stroke, or all of the above.
Lowered blood pressure.
Sorry, it's all of the above.
Really?
Yeah. While studies are far from conclusive, researchers have found that those who eat cocoa-based products like chocolate, and especially dark chocolate, tend to enjoy several health benefits, including lowered blood pressure and reduced risk of certain cardiovascular diseases like stroke and heart attack.
Okay, but what about because the sleep thing? That's what threw me off.
The inability to sleep?
Yeah, maybe it's the sugar or something.
Yeah.
Or isn't there caffeine in?
Funny you should mention that. A 1.5 ounce dark chocolate bar can also contain more than 20 milligrams of caffeine.
Yeah, there it is. Okay,
So there it is.
it was all the above. Dang it.
Question 3. According to sales data from the past 15 years,
Okay.
the most popular Halloween candy is, and there's 4 choices.
Okay.
Reese's Peanut Butter Cups,
No.
Snickers,
No.
M&M's, or Starburst. The most popular Halloween candy in the past 15 years.
M&M's.
You're going to go M&M's?
Yeah.
You're not doing so good today, Angela.
Dang it.
You want to try again?
Is it the peanut butter cups?
It is. Based on sales information, Reese's Peanut Butter Cups were the most purchased Halloween candy between 2007 and 2022. M&M's came in second place. So, very close.
I just think of Reese's as like Easter. Like the little bunnies and little egg shapes that you can get.
They do come in those egg shapes
Yeah,
for Easter time. Yeah.
Yeah.
Gotcha. Question 4. Which ingredient found in some candies will be banned from foods in California starting in 2027? Oh no, now I have to pronounce weird things. And this never goes well. The first one is dextrose.
Okay.
The second is soy lecithin.
Okay.
The third one is red dye number 3. I can
Okay.
pronounce red dye number 3, so
Okay,
I
good,
would
good,
choose
good.
that one. Or citric acid. Which ingredient that's found in some candies will be banned from foods in California starting in 2027? Dextrose, soy lecithin, red dye number 3, or citric acid?
Dextrose. Shoot, is it red dye?
It's red dye number 3.
Okay, everyone always talks about how they're allergic to red dye 40, so the 3 really threw me off.
That begs the question, how many red dyes are there?
Lots, apparently.
Apparently at least 40.
It's 40.
Well, red dye number 3 will be banned in California starting in 2027. So that's good to know if you're planning to visit California. Next question. We'll see if you can get one right here, Angela. Which candy has been discontinued?
Okay.
Pop Rocks, Necco wafers, Bit-O Honey, or Butterfinger BBs?
What was the second one?
Necco wafers.
Are those the chalky ones that kind of look like they're like a mega Smartie?
I am not 100% sure.
Either. I'm going to go that one, though.
I actually knew this one. Butterfinger BBs.
Why? What is
Yes. The Butterfinger BBs candy is a round, bite-sized version of the classic Butterfinger bar.
that? Why is that discontinued? That sounds amazing.
It debuted in 1992. I remember eating them growing up. But it was discontinued in 2006 because of low sales. So they weren't selling.
Wow.
Got rid of them.
It sounds like a great idea, though.
They should bring them back. They were really good. I remember really liking this. Question 6. Which type of sweet is the least likely to harm your teeth? Least likely to harm your teeth. Lollipop, chocolate, caramel chew, or a sour gummy?
Lollipop.
The answer is chocolate.
No, it's not.
Any candy that is sticky, gooey, or chewy can adhere to your teeth or wedge into its crevices. The acids in sour candy can also wear away at the protective enamel of your teeth. Because chocolate isn't as sticky as these other types of candies, it is a better choice for your oral health, according to the American Dental Association.
Okay, but here, let me explain my thinking with that one, though, because a lollipop, you're just kind of like, it's just hanging out in there. You're not like chomping on it. You know what I mean? Like, so it's not as...
You don't just chew up your lollipops?
No. I don't want to shatter my teeth.
My wife bites the lollipops before I do, so that we always get in an argument, because I never do. I suck until there's no more lollipop to go. But she always just chews it like pretty much straight off the bat.
Really?
I know. Yeah. It's wild to me.
So no, like, is that with the ones that are filled, like oh my gosh, the bubble gum ones? What am I thinking of?
Like blow pops?
Yes, thank you.
No, just regular old lollipops that don't have anything in it. Yeah.
So she doesn't even enjoy it, really.
That's what I say.
Yeah, okay.
Yeah,
Well,
that's
hey,
what I
to
say.
each their own.
To each their own, absolutely.
All right.
Question 7. Which candy has the least amount of sugar per fun size piece or packet? So for the
Least
small
amount of
ones.
sugar, yeah.
Least amount of sugar. Nerds, Tootsie Pop, candy corn, or Kit Kat? Least amount of sugar per fun size piece or packet.
Tootsie Pop?
You're going to go Tootsie Pop?
Yeah. Oh my god.
Sorry, the answer is Kit Kat. A trick-or-treat sized Kit Kat contains about 8 grams of sugar. A mini box of Nerds, a Tootsie Pop, and a small packet of candy corn each contain about 11 grams of sugar. So, now you know. Kit Kat.
Jeez, I'm really doing bad on this one. I'm being humbled because I thought I was going to get a lot of these right.
Well, that's okay. I mean, I only knew the one for sure. The other ones I would have been guessing on, so I probably wouldn't be doing a whole lot better. Question 8. Which statement about taste is true? So I'm going to give you 4 statements. Statement 1. All of your sweet taste buds are located on the tip of your tongue. Statement 2. Having a sweet tooth is based on your personal preferences, not your genes. Statement 3. Children need more sugar to experience the same level of sweetness as adults. And statement 4. Adults prefer the taste of sour candies more than children do.
And this is which one's true?
Which one of these statements about taste is true? I can repeat any of them if you want, because there's a lot there.
No. It's okay. I got it. I think it's the third one.
You think that children need more sugar to experience the same level of sweetness as adults? I'm not saying that like it's wrong. I haven't pushed it yet. I don't know which is wrong. That's what you're going to go with?
Yeah, I don't know.
Oh, look at that. You got one right.
Yay!
Researchers have found that when children are given a sugary drink, they need a higher sugar concentration than adults do in order to detect a sweet taste.
Huh. Yeah. Which makes sense because I feel like as an adult, I like eat things that I would have eaten as a kid, and I'm like, oh my god, this is like way too sweet. How did I even enjoy this as a child?
Right.
Look at that. Science is a thing.
Science is a thing. Next question. How many Skittles would you have to eat to ingest the amount of sugar in a can of Coke?
Whoa.
Is it 30, 50, 60, or 70 Skittles?
60.
60 Skittles?
Mm-hmm.
This was tough because they were all right around the same. Like they didn't give you like a huge gap. The answer is 50. One can of Coke contains 39 grams of sugar, the same amount as in 50 Skittles. The American Heart Association recommends that women consume no more than 24 grams of sugar per day and men no more than 36 grams per day.
How many Skittles would that be?
This sounds like a word problem that I didn't do so well on in school.
Yeah, seriously.
So we're gonna leave that one there. Last question, number 10, and it's just true or false again.
Oh, thank God. Okay.
True or false? Candy is the biggest source of sugar in the American diet. True or false?
In the American diet?
In the American diet.
And we're talking about like the general diet, not like the recommended diet.
I'm assuming that's just Yeah.
I'm going to go
everything.
no.
You're going to go false?
Yeah.
You got it right.
Because of carbs. Carbohydrates break down into sugars.
Sugar is in soda. That's where we get most of our sugar from. So you got 2 out of 10.
All right.
Correct.
Well, listen,
You know what?
I tried.
You did try, and those were tough questions.
They were. Not really. I'm sure there's someone listening who's probably like, it wasn't hard. I got all of those right. But that's okay.
Halloween is fun,
Halloween is fun.
and you should have some candy, but in moderation.
Yeah.
Because you want to enjoy Halloween, but you also want to be cognizant of your health.
For sure.
And yeah, it's always good to do.
Well, according to the quiz, what we really need to be doing is watching our soda intake
And working on our word problems.
and working on our word problems.
What's your favorite Halloween candy?
A great question. I would say, and when it comes to candy, any type of like Smarties, Nerds, anything like that. I'm not like a super chocolatey, like I don't do a lot of the chocolate ones.
Really? Okay.
Yeah, but I would do a Rolo.
Rolo. Interesting.
Rolo. Yep. Lost a tooth on a Rolo when I was a child too. That was wild.
Was that on Halloween?
No. Nope. Just
Just bit into a Rolo and that was it for the tooth?
just
Okay.
popped it right out. What's your favorite candy?
I gotta go with the Reese's peanut butter cups. Classic. Yeah. Since it's the most popular one, I guess I'm not alone.
I guess not. Yeah, it's a pretty popular one.
And Butterfinger BBs. They ought to bring them back.
Yeah. Petition to bring back Butterfinger BBs.
Thank you for listening to the Health is Real podcast from Franklin County Public Health. We want to hear from you. Let us know your thoughts at fcph@franklincountyohio.gov. And be sure to follow us on your favorite social media platforms. And did you know that we offer vaccine clinics and education throughout Franklin County for both children and adults? Talk to a public health nurse to ask questions or schedule your vaccine appointment by calling us at 614-525-3719 or email shots@franklincountyohio.gov.